And welcome to the Thurston County Commissioners Agenda Setting Work Session for Tuesday, March 10th, 2020. They have to speak up everything now. By way of introduction, I'm John Hutchings, the chair of the board, and to my right is
Hi, Menser.
Thomasina Cooper.
Ramiro Chavez.
I'll hit the bench first.
Katie Johnson. Megan Porter. Elizabeth Bedridge.
And sitting at the table is Lee.
Shelley Slaughter, Director of Thurston County Public Health and Social Services and Administrator of the Board of Health.
Kurt Harden, Emergency Services Director.
All right, and so we're going to go through rapidly. We have a action-packed agenda work session this morning, and we've got to end about 11:15, 11:20. We got to be completely done for an executive session.
Yeah, thank you.
And so we're going to start with the COVID-19 update, please.
Good morning again, Commissioners. We have had a lot of change since we last spoke last week about COVID-19 developments. So I'm going to start by giving you the situation report as of this morning. I will start by saying we continue to have no confirmed positive cases originating in Thurston County. There are several tests that are pending in Thurston County and throughout the state of Washington. As this week, we have seen an increase in the availability of testing. So last week when we had spoke, University of Washington just had come online to support the Washington State Public Health Lab in Shoreline. Since then, in addition to University of Washington, there are private labs that we are hearing of that have increased capacity and capability to do testing of individuals, and any physician may order those tests. So I'm going to give you some international, national, and state statistics. So as of this morning, globally, we have 109,577 positive cases of COVID-19, 3,809 deaths. There are 213 cases in the U.S. In Washington State, we continue to see some concerning spread into multiple counties. So as of this morning, 162 cases in the state of Washington, including 23 deaths. 20 of those deaths occurred in King County and were primarily associated with the Life Care long-term care facility. One death recorded in Snohomish County and one recently in Grant County. Other cases are Clark County, 1 case, Grant County, 1 case, Jefferson County, 1 case, King County, 116 cases, Kitsap County, 1 case, Kittitas County, 1 case, Pierce County, 4 cases, and Snohomish County, 37 cases. Any questions thus far? Okay, so in Thurston County, we have been preparing since February 6th. So we've been in incident command, as you know, working very hard. And I just want to take just a quick chance to really commend our incredible staff who have been working night and day, weekends, to mitigate the spread of COVID-19 in Thurston County and to respond to the public, healthcare providers, schools, colleges, public officials, everyone that has been asking for guidance from Thurston County Local Public Health. We also have a really amazing, small but mighty investigation team, and they have been working really hard to do lots of follow-up and be working to prevent this. So I just want to say thanks to everyone. Also, thank you to emergency management, who's been a tremendous support to us as we continue to scale up and prepare. We continue to share with the public that the best way to prevent COVID-19 and to slow the spread of this in Thurston County is to stay home if ill. We cannot emphasize that enough. Anyone who feels sick at all, again, symptoms of COVID-19 are similar to other viral illnesses, and so that includes fever, cough, difficulty breathing are the primary symptoms of COVID-19. We strongly encourage and recommend that people who are experiencing these symptoms or think that they may have been exposed to COVID-19, that they stay home, they self-isolate, and they call their healthcare provider and do not walk into urgent care or our local hospitals unless they have an urgent need for medical care. We're trying to protect our healthcare system and ensure that we are prepared and ready to serve those that are most sick. With those deaths that we have seen in Washington and elsewhere throughout the world, it continues to be certain high-risk populations that are most impacted by this. So that includes people over age 60 and people with chronic underlying health conditions such as heart disease, lung disease, kidney disease, diabetes, cancer. Also people with compromised immune systems and pregnant women. These are all people that we recommend take extra precautions to protect themselves from this illness and take every precaution to avoid others who may be sick. We are continuing to have lots of conversations around social distancing. As we discussed in the previous week, we recommend other measures aside from staying home when being sick, include using good etiquette when coughing or sneezing, ensuring that people are properly covering their coughs. Also, that sanitizing surfaces. The virus can live only a very short time on surfaces, but we recommend people do that because the primary way to contract COVID-19, we believe, is through droplets. So when someone sneezes or coughs, and it can get into the eyes, nose or mouth. We also encourage people to wash their hands. So good old-fashioned soap and water for a period of time. Washing your hands, we recommend singing "Happy Birthday" twice while you wash your hands is a good way to protect yourself. So we ask people to increase their hand washing and their hygiene. We also are having lots of discussions, again, around social distancing. So we say a 6-foot distance is a good distance to protect yourself from someone who may have COVID-19 or any kind of illness. We're continuing to have discussions around what kind of further measures that we as Thurston County should be considering to mitigate the spread of COVID-19 in our community and how we can protect our most vulnerable populations who are at high risk for complications of COVID-19. As you know, the governor of Washington most recently encouraged people to be thoughtful and consider social distancing and urged local governments to start thinking about other non-pharmaceutical interventions, is what we call it, to slow the spread of this. So that may include things like canceling of meetings, changing the way in which meetings or large assemblies of people happen. At the greatest extreme would be cordon sanitaire, where you're restricting movement in an area that's highly impacted. Also, closing of schools, childcare facilities, businesses, workplaces is also another measure of last resort that can be considered when there's widespread community illness. Again, in Thurston County, we're not at that point. We are being watchful and mindful of how this is progressing in our neighboring communities and throughout our state. Some things that we consider when we think about taking stricter measures to increase social distancing in our community would include how widespread the illness is, the number of people impacted, and severity. So those are some things that we are starting to think about, considering how we can modify some of our own daily practices to ensure that we're practicing good social distancing etiquette. So that might mean not shaking hands. That might mean choosing to not attend a certain extracurricular type of event, and other various ways, telecommuting, online meetings, things like that. So I expect that we'll be having more conversations about that, and we are in consultation with our health officer. Right now, Dr. Lindquist, Dr. Lofi, later today, you will consider an item to appoint a temporary health officer, Dr. Diana Yu, to assist us further in our COVID response in the coming weeks. Any questions?
Questions or comments? Go ahead, yeah.
So two sort of, as you say, non-pharmaceutical interventions that have been suggested to me that it's not really a question for you, Shelley. I guess it's more of an issue for the board, but would be to increase the frequency of cleaning our bathrooms within the public buildings that we have, which I understand will be, resources required, but maybe something we need to do. And second would be this, like having, you mentioned several times social distancing, and we have staff that doesn't have that, always have that ability to create that social distancing. So one suggestion was to just have a small supply of masks for those departments that have public counters that they could give out if they have to have an extended interaction with the public. And I think at our last briefing, it was suggested about having a station a la Kaiser or Group Health, and that's not, and then I think subsequently we found that those are being stolen, and that's not a good approach. So sort of refinement of that idea would be to just have them so that our staff could give them in an appropriate situation. That would be, I think, two measures that I would support unless you can describe that as being bad policy.
I can say that
I've got a lot of input from different folks around the county and what we're doing here for our staff.
great. Increased sanitation is something that Thurston County Public Health is recommending for everyone, to increase your normal sanitation efforts. So increased cleaning, having access to hand sanitizer readily available for employees and for the public, ensuring that surfaces are wiped and cleaned after each contact, things of that nature. So that's definitely something we recommend. Public health widely in Washington State and in Thurston County is not at this time recommending that masking be used by the general public. We have a mask shortage, and I think Director, I just gave you big promotion there, Kurt. Director Hardin will share some more about what some of our supply looks like for personal protective equipment, such as masks in Thurston County. But we really, there is a national mask shortage. There's a Washington State shortage. We are trying to preserve masks for those that are ill, for healthcare workers and first responders. So we don't encourage businesses to do that and at this time, and to utilize other social distancing type of measures other than masking. There has been some change in the last couple of days on masking guidance that we're continuing to track with Center for Disease Control. That includes that N95 masks or respirators for healthcare providers and first responders be recommended rather than required. And so surgical masks can be appropriate and used in certain situations. But again, that is targeted to those who are at greatest risk. And so we continue to not recommend that, but that may change.
Well, just to be clear, my proposal is that it would be only used for those who are ill and in the risk category. I mean, it's not like walk into the auditor's office and get handed a mask. That's not what I'm proposing. I'm proposing that if there has to be an extended interaction between a member of the public, and that could be based on the risk criteria that you've explained many times, and one of our staff members, then that member of the public could be handed a mask. It might happen twice a day. It might happen once, it might not happen at all in a day, but to have that availability is something that's been requested from our staff in different departments. I know in at least one office or department, there the director is seeking to acquire them, you know, and so it seems like it would fall within the parameters of what you just described.
Kurt Harden, again, Director of Emergency Services. Right now, we don't have sufficient mask supplies to even provide for the non-EMS personnel in Thurston County. I've got requests up to the state for one hospital for a large request because they are running out. I've got requests for a private ambulance company up to the state because that can't be procured. So if we're going to take masks from our stockage, we're taking them from EMS personnel who are dealing with sick patients every day, or taking them from healthcare workers. So I would say that because there's a shortage right now, we can't get them commercially. We are going to the state, and they're tapping into, at the federal level, the national stockpile, the national strategic stockpile for these resources. And the guidance, again, is only for first responders, healthcare workers, those people interacting with sick people every day. And so to do that, and I will obviously defer to any direction that I'm given by the board or by the county manager, but I would have to be taking it willfully from a first responder or a healthcare worker.
I don't think that would be my request.
No, I understand.
If we can put it on our wish list because
Absolutely.
I'm imagining that more masks are being produced, and that as this situation evolves, we're gonna have potentially, that it's gonna be a changing situation.
And I'm not saying that that's what you're requesting. I want to make it clear, I was not suggesting that, but I think that I'm trying to put in perspective for those others who are listening, who are out there, that I understand there's a concern, but right now, for the general public, there's a low risk, is that a correct statement? Low risk of acquiring the coronavirus, but there are those who are in contact with sick patients, sick people every day, and that's their job, to be in contact with them. And I'm just trying to put it in perspective, because nationally, there's a shortage, and they're trying to work towards that, but I will tell you that there's a shortage in production capacity, is my understanding, at the national level as well. And that's being addressed at the national level by Health and Human Services and other folks. But honestly, when we get down to this, I'm already asking for help. And that's outside Thurston County. Inside Thurston County, we have sufficient supplies right now, but we can't give out what we have for our first responders, our EMS staff.
Is there capacity to increase the cleaning of our restrooms?
Yeah, I have a note in there, and I have received some feedback on that as well. So I'll be working with facilities to see if we can do that.
And also,
For that.
And we have to see how much money it's going to cost. Yeah, so by money. Yeah.
and I just want to go a little bit more into, and to dovetail on to Director Slaughter's comments, the Emergency Coordination Center, the Thurston County ECC, has been activated since last week. It's at a level 2, which is partial activation. It's activated for Emergency Support Function, or ESF 4, which is Fire EMS, Emergency Support Function 5, which is Emergency Management, ESF 7, which is Logistics, ESF 8, which is Public Health, ESF 13, which is Law Enforcement, and ESF 15, which is Public Information. The reason we have ESF 13 activated is because we want to make sure we're taking care of our law enforcement first responders as well. They traditionally don't have the same PPE as we do for EMS, and so we're working with them to make sure they have sufficient PPE for this situation and are following guidance as well. So I will tell you, I just mentioned a little bit about the resource requests that we have going up to the state, and we're hoping and we're hopeful of getting those filled. I will also talk about, we already talked about social distancing. I think additional guidelines are going to come out from the governor today and tomorrow regarding some of these NPIs, non-pharmaceutical interventions. We're also looking at long-term care facilities. I know that there's been a voluntary push at long-term care facilities to limit people going in and out, and I think they have individual guidelines that they've got in place for their residents there. But I think we can expect today that additional guidance is going to be coming from the state to make it mandatory on screening all personnel going inside of long-term care facilities and taking prudent precautions, because the virus does have a significant impact on people over the age of 60. And I will tell you that we have to be cognizant of that, because we've seen what happened at the long-term care facility in Kirkland and just how it went through that facility so fast, and it was very rapid. And so we're taking steps, and the governor will come out, my understanding is today, to take additional steps to make sure that we're taking care of the patients and the residents in those long-term facilities. Go ahead. Yes.
Real quick, Kirk, can you define PPE for folks to see?
Oh, sure. Personal protective equipment, and what it is for EMS, it's masks, it's eyewear protection, either shield or goggles, and gloves and gown. And so, and a gown meaning it's just a gown they wear, they put on, and then they can dispose of. And the gloves and mask are disposable, and the gown is disposable, the goggles and the eye shield are reusable.
Thank you.
Yes, and just finally on the non-pharmaceutical interventions, we may be again hearing more clear recommendations from the governor. Also, the Secretary of Health, the State Health Officer, the Board of Health, and the Health Officer may also all implement those kind of non-pharmaceutical interventions in a community. So we will follow what the state recommendations are and share that information with you. And then we may have additional conversations to consider. If we have a positive case in Thurston County, we will be informing the public immediately, as well as sharing that information with the media.
Go ahead.
So it is imminent that we're going to see some cases in Thurston County. It's just a matter of time. As the testing kits are becoming more available and we test more people, it's just bound to happen that we're going to have cases in Thurston County. I don't think is that going to be a representation. The disease is spreading. Perhaps it's just the way we're testing individuals. So we're working with your directors, if warranted, to have an emergency declaration for your consideration. So the language is in place. And if we get to that point, we're also working on communication strategies. So we're gearing up when and if we get to that point.
Okay. Commissioner Rivers?
Do you have any numbers of what we're normally faced with the flu, for example, and deaths, flu compared to?
Yes, well, what we do know is that in the United States, more people have been infected with influenza type A and B, and more people have died. Even in Thurston County, we've had 5 deaths this flu season. So more people have been impacted by the flu. However, what we are seeing with COVID-19 is that the case fatality rate is higher than typical influenza. So that ranges from 1% to 3%. Again, those numbers shift as we have more confirmed cases and deaths. So that's something that we continue to track. We do want to say that flu remains prevalent in our community. We have not escaped the flu season yet. We strongly encourage people to still get a flu shot. It is still effective, and it can be a really good way to prevent the flu, shorten the duration and severity of the illness, and help healthcare providers be able to rule out COVID-19, because, as you know, some of the symptoms can be similar. So that can be helpful. So we strongly encourage people to continue to do all the things that we recommend to prevent any type of viral illness that might make people sick and can lead to death.
One more follow-up on that, and I'm not advocating for a particular product, but you hear about something called Theraflu to treat the flu with. Is that also a treatment that would work if you did come down with this?
No, unfortunately, no. That's one of the reasons why we're so concerned about COVID-19 from a public health perspective, because we do not have a vaccine or an antiviral treatment that is known to be effective against COVID-19. We're still learning a lot. It's still new. So there's a lot of things in progress, but we don't have those available to us yet.
It's like NyQuil or something. Symptoms.
And I was going to add to that, one of the challenges is that we have 75 years of data on the flu. We have 75 days of data on COVID-19. And so that's part of the challenge, is trying to get that 75 days worth of data and make something out of that. And so anyway, the other piece I was going to talk about was we are also have thresholds and trigger points that we work with public health on, that if the situation changes, we would take and recommend the ECC, the county ECC, going to a level 1, which is full activation. We're not there yet, but we do have established points where we're talking about what would it take to bring us to a level 1.
All right, we're gonna wrap this up after I make a comment, a couple comments on a question. Regarding social distances and such, will you please have your office reach out to Pam Hartman-Beyer, clerk of the administrator of the courts, rather. I had a chat with presiding judge Eric Price this morning, and they would like more information and probably one-on-one regarding the jury pool and put people together and the best way to approach that and their own safety over there.
Yes, we're happy to do that. I called district court this morning, so Ms. Byer's on my list. Thank you.
Okay, thank you. And Maple Lane, I want people to know that Maple Lane, the prison in Grand Mound, has been designated by the state as a quarantine zone for the last resort people that have absolutely nowhere else to shelter to be quarantined, and they put trailers down there. And I want people to know that even though the county had discussions with the state overall owns the property, and they designated that area, not us. And the community of Grand Mountain is not very happy with that. Just want to pass it on. It was not Thurston County doing that. And public health and social services, your department, you deal with algae bloom, sewage spillage, restaurant inspections, substance use disorder, flood victims, and a squalling. But those are site-specific locations that you attack and take care of things. This is not site-specific, and this is huge and vast. And I understand your staff is, I'm not going to say overwhelmed, but is currently meeting the challenges that face them. And you're rising to the occasion, all of you, and I just greatly applaud our PHSS folks as well as our EMS system. So thank you.
Thank you.
All right, thank you. We're gonna move on with homelessness strategies. Katie Marino, come on, please, come on up.
Good morning. Keely Marino with Public Health and Social Services. I didn't get to see you last week, so I have a lot of updates for you. One of the updates is that promised point-in-time count graphic. So those are the preliminary numbers that I mentioned last time I was speaking with you. Nothing really has changed. We did put some comparative data down at the bottom right-hand corner that shows you the differences in the count between 2018-19 and 2020. On the back, we've added just some explanatory texts just to explain and contextualize some of the data, so just to make an easier sense of it. And at the very bottom of the second page, it does break down by individuals how many surveys per jurisdiction, and so it breaks it down into Olympia, Tumwater, Lacey, Yelm, and others. So we will be looking forward to the final numbers from Commerce coming in May, and then you'll be receiving the full report on the PIT at that time. Any questions on the PIT?
No.
Great.
Very excellently with me yesterday, and I really appreciate it.
Yeah.
Although that meeting's been canceled,
Yes, I've been told.
but I learned a lot.
Yeah,
Thank you, Keely, very much.
absolutely. So just really quickly, legislative updates. Some bills have passed that are important. One being House Bill 1590. 1590 is the council-matic vote on a home fund levy. That passed and is waiting for the governor's signature. The House Bill 2384, fixing the property tax exemption for affordable rental housing for very low-income households also has passed and is waiting for the signature, for the governor's signature. House Bill 1694, which requires landlords to take installment payments for deposits, that has also passed. That is on the governor's desk. The trailer bill to 1923, last year's House Bill 1923, this year it is House Bill 2343, is on its way to the governor. So they've come to an agreement on that trailer bill, and that's going to the governor. And that's on affordable housing. It lowers the transit frequency rate required in order to prevent local jurisdictions from requiring parking for affordable housing. Let's see, other exciting ones. The House Bill 2797, which is the improvement bill for House Bill 1406 from last year, is in the Senate Ways and Means Committee this week. There's been some amendments that were thrown in that would remove the 6% admin fee that this bill was set to provide, which did not exist in House Bill 1406. So they're working on that right now. Hasn't fully passed. Looking.
Is that one looking dubious?
I don't think
Or
it's
do we
looking
know?
dubious. From my understanding, the last update I got, there were 3 amendments. The first one, I didn't hear what it was. Our ACHS, which is the Associated Counties Health and Services person, her name is Juliana Rowe, reported the first amendment wasn't of concern. The second amendment was to remove the 6% admin. The third amendment was then to just reduce it to 3%. So I think it'll be fine.
Okay.
So those are some of the highlights on the bills and what's going on in the legislature ending this week. So we'll get full updates by the end of this week. And in terms of our response, speaking of vulnerable populations and the COVID-19, we're sending out as much information as we can from the CDC and Department of Commerce for working with homeless individuals and preparing for any kind of COVID outbreak in our homeless response or in our homeless crisis response system. The Hazardous Weather Task Force is having an emergency meeting this Friday to meet with shelter providers and hear what plans they have in terms of if they need to quarantine anybody within their shelters, or just kind of get a sense of where the shelter providers are currently in their planning. And then also just brainstorm a little bit together. I'll be meeting with the City of Olympia team today to talk about the mitigation site. I know that that is a site of significant concern if there were to be a COVID outbreak in the homeless population. So we'll be sitting down together around the table to come up with a plan today for them. And I think that's about it for me.
Yes, sir.
Can you describe the grant that we're applying?
Oh, yes.
Yes.
Yes. So there's 2 things actually that jog my memory about another grant. LOT, Lacey Olympia Tumwater, Thurston County Water Treatment has a grant. They granted City of Olympia 2 hygiene trailers, so up to $75,000 per trailer for the City of Olympia to supply one for the mitigation site and for Plum Street Village. There is $100,000 remaining balance in that grant for another jurisdiction to purchase and then place a hygiene trailer. So we've been working with the City of Olympia. There's a Olympia construction company who creates shelter box or hygiene boxes out of shipping containers, and First Christian Church and others to come up with a plan for how the Thurston County can take advantage of that $75,000 grant. We're hoping that we can move forward swiftly. Our declaration of public health crisis, we're looking into see whether that the declaration covers something like a hygiene unit, so we can move swiftly to get, especially now considering COVID-19 response, getting a hygiene unit somewhere where it's needed.
Questions or comments?
How about 80 auxiliary dwelling units in the county? How'd that compare?
I'm not aware of how that's faring in the county. I do know that the ADU bill at the state level didn't pass. It didn't move forward. And then the City of Olympia is working on their zoning legislation, but I don't know where we sit with the county, to be honest.
It's on the docket. They're working on it.
It's on the docket.
So staff is working on the ADU.
Yeah, the state didn't give any authority for counties to come up with that, where they have them with
I think
municipalities.
the proposed legislation, it would have given the counties a little bit more flexibility in the rural areas. Unfortunately, that bill didn't pass. Yeah,
It was a mandate.
right.
It wasn't just flexibility, it was requiring X, Y, Z, A, B, C.
Yeah, on
and that's
the
where it
rural
got
areas,
hung
yeah.
up.
But we're still working on it though, at the county level,
Yeah, that's part of the code amendment, yeah.
okay? Yes, sir.
Keely, I a couple weeks ago got a link to a video that showed the rollout of the Olympia's community work groups, response plan and strategies. And so my question is, I haven't had a chance to dive deeply into that yet. It's on my desk. But I wanted to know if you, are there strategy, or is there a way for the county to piggyback on that work? Are there strategies? Because what I understood about, what I did read was about the process, and part of their process, first of all, I participated in a couple of the sessions, so I know what a good process it was. And second, part of their process was looking back to our county 5-year plan and making sure they were being consistent and helping to implement our plan. So there seemed like there could be a synergy there, and I'm wondering if to what extent are the strategies in that plan applicable to the county? Would it be appropriate for us to adopt that? I know, our emergency ordinance from way back said that we're gonna support and join City Olympia, working together to find solutions. So this seems like a place where we can, use the robust process that the City of Olympia engaged in to try to support their efforts. Is that?
Yes, in fact, we started meeting last year in I believe April or May on a weekly basis. Amy Buckler, Stacy Ray, myself, Carrie Retland, Anna Schlecht, and other members of the City of Olympia response team to ensure that our strategies were in alignment from the get-go. And so I attended several of the sessions as well, and participated as scriber, whatnot, with the City of Olympia, and have been with them kind of lockstep throughout their whole process. And so prior to them releasing that, the response plan to City Council, we did a crosswalk, both with our 5-year plan and with the opioid response plan, to ensure that our strategies were in alignment. And we have that document, and I'd be glad to show it to you. We're continuing to work with City of Olympia to make sure that our strategies are neck and neck. Yes, so I'd be happy to share that crosswalk document with you.
Maybe next week?
Sure.
Yeah, my ask is just if you see ways in which we can be supportive, please bring that to our attention so we can discuss that.
Absolutely. I'll be meeting with Amy Buckler this week or next week to talk about performance measures, because the county we have performance measures that we must meet for the Department of Commerce and the funds that we get through the Department of Commerce. So we're going to be working together to identify performance measures for the City of Olympia's plan that support, or that our performance measures support their efforts, so.
Tina, are you in a position to talk about that, the $13 million or about $25 million grant from the county? From the state, rather?
Yes.
Regarding, and all the parameters around that?
Sure. So on Friday, February 28th at 12:01 p.m., we received an email from Ted Kelleher at the Department of Commerce. The email was a request for all local communities to consider how we might increase our shelter capacity by providing new beds. They have $13 million, up to $13 million that the state wants to give to communities to develop new shelter beds. That $13 million for those new shelter beds are between April 1st of 2020 and the end of June. So these dollars are coming from the windfall that the state experienced this year, the surprise revenue that they had. And as you may recall, the governor had put in his supplemental budget tapping into the rainy day fund to help with increased shelter capacity. With this windfall, they decided that they didn't move forward with that vote. They're just taking this money and giving it to counties and cities. It is not an RFP. It is not a grant proposal that we'll be writing. It is ideas and a draft plan that we have to send by the 17th of March, so next week, to Department of Commerce. describing how we might increase our shelter capacity between April 1st and June 30th, and then subsequently how we can increase it even further starting on July 1 for the following year. $13 million would be available starting April 1st to be used between April 1st and June 30th, 2020, and then upwards of about $25 million for starting in the state fiscal year, July 1 through June 30th of 2021. So we had the opportunity, Tom Webster and I had the opportunity to be on a webinar where Ted Kelleher just happened to be around, and he hopped on, and he made it incredibly clear that the communities that will be prioritized for this funding are communities where the city and the county, cities and counties are working very closely together and making a proposal together. The remaining, all of the funds will go to those communities that are working really closely together. Individual cities or individual counties will not be prioritized, and if there is any money left over, if there are any funds left over after those those that are prioritized, then they will distribute money to individual cities and individual counties. So it's very exciting and it's very overwhelming. We're working with the providers and jurisdictions to come up with budgets. What can we do? What creative things can we do for the April 1st through June 30th deadline? We're considering how to extend shelter beds that are already contracted for the cold weather season. Does that count as new beds if it's no longer the cold weather season? What works? Does hotel rooms work? Like what's going to work? And Ted Kelleher was clear that they're going to say yes more than they're going to say no. So they just want to get shelter beds happening now. They want it to be treated as if there was an earthquake and 10,000 people suddenly didn't have homes. How do you respond? So it's very exciting.
We'll make that March 17th deadline?
Or yes, we are making it. Yep.
Yeah, thank you.
Who's the person at the top of this effort to get this submission done?
Tom Webster.
Tom Webster, okay.
Yeah.
Go Tom.
Yeah, go Tom.
There's a lot of data that needs to be added to this. So
Yeah.
Yeah,
That's exciting to hear, it really is.
yeah,
That's just a chunk of dough we can count on.
absolutely.
And we have been working with the cities and the county.
Absolutely.
So we good. Anything else from Keely? Nope, thank you, Keely.
All right, thank you.
Now we're gonna go through and review the agenda for March 10th, 2020, and we'll call the meeting to order at 2 o'clock. Pledge of allegiance led by Vice Chair Commissioner Menser, and approval of the agenda and board meeting minutes. Then an opportunity for public comment. Are you aware, County Manager, of public comment?
nothing that I've heard.
Okay, Commissioner? We'll all be surprised. Okay. County Manager update.
I don't have any specific updates today.
All right, consent items A through G. The first one is District Court, amending a contract between District Court and Grimm Collections.
Yeah, Commissioners, you reviewed this item last week, and District Court has a contract with Grimm Collections. They expired back in December 31st, 2019. And this District Court is asking the board to consider extending the contract for 3 years with an option of 2 one-year extensions after that date. Grimm retains a portion of, there is not a funding related to this contract. How Grimm gets compensated, they retain a portion of the interest collected on the fees as part of their compensation. As a matter of background, Grimm has collected approximately $1 million in the last year in past due accounts, and also have collected close to $70,000 in interest that comes to the county. Do you have any questions?
No, sir. 3B, Superior Court reclassifying a position in Juvenile Court.
So last week, items 3B and 3C are related. And this is reclassifications on juvenile court. So I finally got the chance to have further information to this. So this is what is the proposal. Superior Court Administrative Services Manager, they had a position that was vacated late last year. And they're not planning to fill that position. So through the reorganization, they're trying to create a little bit of different structure. So to the result of, so that position is 83,000 thereabouts. that position, there is not going to be filled,
Ever.
period. So as a result of that, they had gone through and reclassifying a couple of positions. One, before you, is the Administrative Services Manager. Two, a Senior Management Assistant, which is that is an increase of $1,003 a month, or 12% increase. In item 3C is the reclassifying Administrative Assistant 1 to a Court Accounting Supervisor. And that is an increase of $1,416, or 28% a year. So adding all the different classifications and considering the savings of that position where it's not going to be filled, then the end result of this is going to be a net gain of $25,000. So I believe Superior Court and Juvenile Court has gone through this process of assessing to stay within their means. And it's not like a previous other reclassifications that perhaps you reclassify this and you will be bound on the upcoming budgets. In this case, is they're trying to eliminate that higher level position, and they distribute the funding through the reclassifications, items 3B and 3C.
Well,
Did that make sense?
It makes perfect sense, yeah, and I support that. However, we had a question last week when we talked about this, someone going from an assistant 1 to an accounting supervisor.
Yeah, and that
Yeah.
really is not an individual who's holding that position.
Okay,
It's not. So they creating a new position. They go through the advertisement process.
okay.
Yeah.
Questions? Anything? Good, thank you. 3D, the local agreement with Pack Mountain Workforce Development.
There was an opportunity for us to secure a grant from the Pacific Mountain Workforce Development Council, and we were successful to receive $14,300. And this grant is to provide certified government financial managers exam preparation courses. And this will be given by the Government of Accountants. HR was very successful again in securing this grant, and this interlocal agreement is to secure the $14,300 to come to the county so we can go through that certification process for our financial staff here in the county.
Okay, anything?
Yeah, one question I have is, when we're spending money, we try to keep it within 10%. When we're receiving money, how come we put that in there? I'm just curious, because
And
more money becomes available.
Yeah, and
We want to be able to get it, right?
yeah, in the event the more money becomes available, so we have access to.
Right, well, I'm just wondering why bother, why put the 10% in if 14% becomes available, I want them to get it.
Well, the 10% is the norm based on the procurement policy that you passed.
Right, except we're waiting for money to come in instead of going out on this issue.
There's suggestion from the staff based on the procurement policy. If the board feels that you want to
I
give
just don't
further
see a
authorization.
need for it. If more comes in, I don't know that they need to come back to us. We get 15%.
You're suggesting there would be no limit?
I have, as far as what's coming in. Right.
Okay.
I'll suggest to be consistent, commissioners, with the 10% as you authorize all the different grants,
Even though it's coming in.
even though it's coming in.
So we'll just have to tell them we can't take 15%.
No,
That's the board.
we will not tell them we cannot take 15%, Commissioner. We just bring this
Okay,
item back
I'm
to
just
you.
trying to simplify government, which I don't see happening very often.
Any questions, comments?
Okay.
Okay. 3E, Community Planning Economic Development, Ag Advisory Committee appointment.
For your consideration, Commissioners, this is an appointment for Mr. Thomas Watson to the Agricultural Advisory Committee. That's District 1, a non-farmer. And I believe you have a discussion on this. And this appointment will go from March 17, 2020 to March 17, 2022.
Never had a discussion on this.
I believe you did last time.
We've had a lot of work before. We've had discussions. It's been a few weeks. Mr. Watson's application was in holding because of waiting to be invited to a board meeting, which he has been, and the staff of the board, Agriculture Advisory Board, has recommended him to be appointed. But it has been on here waiting in limbo for over a month. The first discussions were, we reviewed his application that was attached to your packet. We were just waiting on staff recommendation.
He's a non-farmer, correct?
Yes.
Certainly, if the board doesn't feel comfortable in this appointment, we can delay that, pending any additional information you may need.
With what, the
I
appointment or
don't
delay?
have any problem with the appointment. I think it's been hanging fire.
Yeah, and he attended a meeting before the board met, rather,
Yes.
and they're recommending him.
Yes.
I'm not supporting this appointment, so we can pull it, and we don't need to delay it. I can state my reasons, but the role of of our advisory committees is to advise the legislative body of the county on policy, to try to, in this case, assist with agricultural policy. We have a lot of very concerning agricultural issues, loss of farmland, and et cetera, the stuff that we've seen in the newspaper and presented. So, for example, I checked in with Stephen Brownwell about what the needs are in the Agricultural Advisory Committee. Generically, I don't know anything about Mr. Watson, but like what skill sets could we use to try to advance the goals of the Agricultural Advisory Committee? He identified land use expertise, land trusts, sensitive habitat on working lands, experience, agricultural zoning, knowledge experience. So, Mr. Watson, the only thing really in his application is to ensure personal property rights, thrive with as few hindrances as possible. If somebody's a farmer, if it was a working farmer, that kind of perspective might be useful to make sure government's not overreaching and not interfering with the folks that are farming. But Mr. Watson is not a farmer. He has no experience in any of these issues, and I don't think that that's a good choice for a non-farmer seat on this board.
I don't know Mr. Watson either, so I have to hang my hat a bit on to give some credibility or deference to the committee that's also giving a thumbs up to him. And it's a non-farmer position, so he is a non-farmer. I see that, so that fits. And continue to help Thurston County thrive with as few hindrances as possible and stuff like that. Those issues, I don't have an issue with that, so I support him. His appointment.
So I will move this item.
The board's recommendation.
I will move out of the consent agenda into a department item, and you will exercise your vote this afternoon.
Okay. 3F, prosecuting attorney, establishing positions. That's right, we talked about this last time, several positions.
Yes, I did have the opportunity to talk to the prosecutor's office, and the proposal before you is to consider creating 2 temporary positions that do have time, legal assistant ones, and 1 full-time legal assistant 1. And the full-time is funded by the domestic violence, part of the domestic violence team. So we had a good conversation. We come to an agreement that perhaps those positions will have an end date of December 31st, 2020. And at that point, through the budget process, it will determine if those positions will continue on or not. There was another position, as you may recall, a full-time legal assistant 1, that it was intended to support the implementation of the case management system. The prosecutors and the public defense are working together. Yesterday, I asked Dennis Osorio to engage the prosecutor's office as well as the Office of Public Defense to have a comprehensive assessment as to what resources both offices need to implement the case management system. So that is something else that will come later on.
What's the dollar amount on this going to be?
On these positions?
Yeah. That's going to be absorbed?
This is going to be absorbed this year.
This year.
The prosecutor is not asking for any additional funding. So as you may recall, they're planning to fund for salary savings from the chief, criminal prosecutor, and so
For this year,
for this year.
but it'll come in the fall for next year.
Well, during the budget process, then the conversation will be a little bit different, whether those positions can continue on or not.
Okay. Questions or comments for you on this one?
I'm trying to track this and look at my notes from last week because we had a pretty significant discussion on this. Can you repeat what you said about Dennis's input? I didn't.
Well, the original request was 2 half-time positions and 2 full-time positions. One of the full-time positions, the prosecutors were making an argument, they need that resource for the implementation phase of the court management system. The new system, the prosecutor and public defense are going through the process. The conversation that I had with John Thunheim was we need to look not just to what his office needs in terms of resources to implement the new system, but we have to be looking in terms of the needs of the implementation itself, which the Office of Public Defense also needs to be part of that conversation. So we took that position out of your consideration today, one of the full-time assistants. And I asked Dennis Osorio to engage the prosecutor's office and the Office of Public Defense to start talking about the implementation needs of the case management system. So that information is going to come to you later on.
So this is modified from last week.
Absolutely, yeah.
And just to remind the other commissioners, because there was one position, full-time position, I believe, that was in a slightly different category because the funding was coming from the victims.
And that's the full-time position.
That's still in here,
Yeah.
which I supported 100%. So, okay,
That's the legal assistant one full-time position that is funded by this grant, but also we need to make sure that that grant is sustainable in the long term. And that will be part of the conversation for the 2021-22 budget.
Okay, thank you. That was half an hour, 3G's the auditor, the doctor list, and we've gone through that. Any questions about the doctors?
I have already submitted my,
Takes us to department items, agenda item number 4, central services, a call for sealed bids for the Tilly Sand and Materials Storage.
Yeah, for your consideration, Commissioners, is to give the authorization to say, call for sealed bids to install the sand shed on the Public Works facility located in the Tilly campus. At least from my point of view, this is a long time coming, and I believe this approach is going to be put in place based on the allocated budget amount. There is a couple of steps that we need to take in terms of clearing some of the environmental permitting that we need to go and CPAD. But at the same time, we'd like to, for you to consider approving going out to bid, and hopefully we can secure the bids, and we will not award those bids until the permitting process is clear and completed.
Anything on that?
and the funding source is the road fund,
It's a combination, yeah, it's the road fund, I believe.
but mainly the road fund, I think, right?
And you're right, this has been a long time coming, so I'm very happy with that. So I'm all right with that. Number 5, CPED, approval of an ILA with Washington State University Extension at Thurston County.
Yeah, you also reviewed this item, Commissioners, last week, and this is, again, the yearly instrument in which the county provides funding to the Washington State University Extension, $153,262. This is already allocated on the county's budget, and again, this is just the agreement for us to compensate the extension. How is that going to be distributed? $24,000 will go to the director, $50,000 for the 4-H coordinator, $33,000 to the stormwater management extension, $20,000 for the working lands resource management, and that $26,000 for the 4-H assistant. So it's a combination of general fund as well as stormwater fees.
All right, anything on that? All right, then we wrap it up with reporting back on our board work sessions and assigned committees, and towards our work week, and we're done. That meeting's finished. And now I'm going to turn this over to Commissioner Messer, the chair of the Board of Health, to go over the Board of Health agenda.
I'll wait for Shelley to join us. Morning. Shelley, your left is your right.
Good morning. My name is Stacy Everett, filling in for Lydia Hodgkinson, Clerk of the Board of Health.
Perfect, thank you, Stacy. Okay, meeting will be called to order at 3:30. And we'll have approval of agenda presumably. Item 2, proclamations and presentations. First is Developmental Disabilities Awareness Month.
Good morning again, Shelley Slaughter, Administrator of your Board of Health. Yes, we will start with a proclamation for Developmental Disabilities Awareness Month. Mark Moffett will present the community program. Mark Moffett, our community program manager for our developmental disabilities program, will introduce the CEO of Morningside, Jonathan Plager, who will accept this proclamation and share more about how important Disabilities Awareness Month is, activities that we are doing in our department, as well as what the impact and contributions of those with developmental disabilities have on our community, specifically around employment. So we're really excited to have Mr. Plager here today to accept that proclamation and share more about what they do at Morningside.
Questions on that?
Nope, looking forward to it.
Our presentation and proclamation go together this month. We have a presentation on our county's developmental disabilities program.
Yes, that is correct. We'll do the proclamation first, followed by Mr. Moffett will then share more about our developmental disabilities program.
We've covered all these items. Is there anything new from last week, just on today's agenda?
We have one new item, and that is appointment of a health officer, and we just moved around a couple items.
Okay.
So I'll point those out to you when we get there.
The next category, opportunity for public to address the board, followed by health officer's report and director's report, which you've been covering those in the last couple of Board of Health meetings.
Yes, on behalf of our health officers, I will provide that report. The focus of that will primarily be around COVID-19.
I appreciate that because a lot of folks may be tuning into the Board of Health, specifically looking for that information. So if you could kind of recap, and then if there's, you said there might be state guidelines released today. If something breaks today, you'll update us, I'm sure, at that point.
Yes, I will. We have late-breaking updates on COVID-19 multiple times per hour. So we're really trying to keep up with as much as we can. But yes, we'll be ready to share the very latest information by the time the Board of Health begins today.
Perfect. Any questions for Shelley on items 4 and 5?
No, sir. No, but just backing up, Jonathan from Morningside, good guy. Very good guy.
Very good partnership that we have with Morningside.
3 department items, starting with opioid response update.
So yes, Chair Menzer, this is an item that you request. As you recall, in June of 2018, the Board of Health declared opioid crisis a public health emergency here in Thurston County. And since that time, we have hired an amazing opioid response coordinator, Katie Strozik, and she will be providing an update on our opioid response plan and all of the great activities that have been happening, what has been accomplished, and what is being worked on.
Anything on that? Thurston Thrives update is next.
So yes, Thurston Thrives is one of our social determinants of health initiatives, public-private partnership that we support. And we have a contract with Thurston County Chamber Foundation, which is the fiscal agent for Thurston Thrives. And Liz Davis, our division director for Child, Family, and Community Wellness, now known as Community Wellness, will introduce Crosby Carter. She's the executive director of Thurston Thrives, and will share a quarterly update of all of the great work that has been happening at Thurston Thrives.
Good. The new item is the third item, resolution for appointment of temporary health officer.
Yes, we discussed this item last week. So for the past several months, since Dr. Wood retired, we have had the great honor to be able to work with our state health officers, Dr. Kathy Lofi and Dr. Scott Lindquist, on all of our infectious disease matters. Since COVID-19 has emerged, the state health officers are very busy at the statewide level, and we identified that we had a need to have a specific temporary health officer to help us address a local COVID-19 response. So Dr. Diana Yu has graciously offered to come out of retirement to help Thurston County. For those that may not know, Dr. Diana Yu was the health officer for Thurston County for many years. She retired from Thurston County, I think about 6 years ago or so. And she worked part-time for Mason County as their health officer before enjoying full retirement. So she is going to step aside from some of her retirement activities if you so choose to appoint her as a health officer, part-time, temporary, just to help us cover COVID-19 and our other communicable disease efforts that our staff continue to have to do in addition to COVID-19. And she will replace Dr. Lofi and Dr. Lindquist on the previous amendment to the appointment of health officers that you passed at last Board of Health. You have a concurrent, you do not have a concurrent action on the Board of County Commissioners agenda today. We have resolved that, so you just have the Board of Health request to appoint Dr. Diana Yu.
Questions on that? Okay. Then the Board of Health members will report on health-related activities and will adjourn at 5 o'clock, I would imagine, no later than that.
Good.
Yes, sir.
Thank you.
Thank you so much.
Next on the list is to be determined, the Board of County Commissioners meeting for Tuesday, March 17th. That's an exceedingly skinny agenda.
It's a very short agenda for you.
So let's go through it and then decide whether we want to.
You do have a Transportation Benefit District meeting on that day as
On
well.
that day, okay. So we'll call the meeting to order on March 17th, 2020 at 2 p.m. Pledge of Allegiance led by Vice Chair Menser.
It would be Everett.
We should be, yeah, we just did that, okay? Thank you, Law. And approval of the agenda and the meeting minutes from today. Opportunity for the public to address the board, sit prematurely. County manager update.
So we'll follow up with any comments you might receive today.
And we have consent item A, and that's just the voucher list, and that will come in. The department item, Public Works, is the Boston Harbor boat launch agreement with Washington Fish and Wildlife for the RCO grant.
Yeah, this is related to the boat launch located at Boston Harbor. Just to give you a little perspective on this, the county owns and maintains this boat launch. And we have been having conversations with the Washington State Fish and Wildlife as to how we can probably partner in upgrading the boat launch as really need that upgrade. So they have secured an RCO grant for the construction of the boat launch, as well as improvements to the parking lot and bathrooms that we have in there. One of the requirements of the RCO grant is for the county to commit to have this boat launch open for the next 30 years. for public access. I don't believe that is going to change. That is our obligation to maintain that boat launch. And I think this is a great partnership to upgrade the boat launch. It's not going to be no cost to the county. And the state Washington Fish and Wildlife is going to perform those, the upgrades and the project themselves, as well as the upgrade of the parking lot and the bathrooms. There's going to be another set of conversations later on as to how we're going to be partnering on the long-term maintenance of the bathrooms in the parking lot. Because the bathrooms in the parking lot, that property is owned by the Washington State Fish and Wildlife. The only portion that we own on the whole facility is the boat launch.
And the boat launch is that's the concrete all the way down into the water. It's pretty steep.
Yes, sir.
And what they're planning on doing is opening that up to a different type of. Carrie, do you have the details on this? The way they're opening that up and how it's going to improve the habitat underneath where little fish and bugs, whatever, can go back and forth underneath the dock and live.
Yeah, Carrie Hibden, Parks Operations and Maintenance Manager. Yes, it's essentially a like-for-like replacement, Commissioner. They're going to be removing the existing boat launch and replacing it with another, but it will be adding a small bulkhead to protect the ramp from any degeneration, and it also includes an ADA loading platform for people, and that will be installed at the top of the ramp to allow people to get into the boats before it gets to the bottom down to the water. So, and that ADA loading ramp will connect with an ADA parking stall right next to the launch. It's a good plan. Nice design.
I love that part, yeah.
Nice design.
And it's a longer ramp out, isn't it?
It is a little bit longer, yes, and that's to adjust for the tides that they see out there historically, so people can use it for a greater amount of time.
Any questions or comments? Any questions or comments? I would add the grant is for the boat launch and the bathrooms and the parking lot as well?
Yeah.
Okay.
And the grant is given to the Washington Fish and Wildlife. It's not coming to the county.
So the grantee.
Yeah, and we need, but as part of the requirements again is for the county as the owner of the boat launch to make sure that we maintain the boat launch for the next, open to the public for the next 30 years.
Right. I love this. This is very, very good for that community and for the community at large, the boating public. That's a cool little Boston Harbor, cool marina.
Very heavily used facility too.
Yeah.
It took us a little while to get to this point.
It did. That's why I'm excited to see this.
So it was a lot of conversations in terms of the agreement, but I think we're in a good position.
Very good. What would be the next step?
Well, they're going to go into the construction phase for the launch itself, and that will have to make use of the fish window, so they have a certain amount of time to get that constructed, and they'll actually get that in place. And then they're still finalizing the design on the restroom parking lot plans.
It's helping to make Thurston County a nice place to live, work, and play.
Absolutely.
Do you have any questions of us?
Nope.
Okay, good. All right, thank you.
Thank you.
We still need to talk, but. Okay.
Sure.
Agenda item number 5, Emergency Services, Homeland Security Region Incident Management Team Trailer Purchase.
For your consideration, Commissioners, is to authorize the Director of Emergency Services to purchase an emergency response trailer for the amount of $73,462.61. This particular item was included in 2019 budget, but the Homeland Security Region 3, the incident management team, didn't have the opportunity to get to the purchase in 2018, so they're requesting to have that purchase in 2020. There's a couple of steps in the process. This is coming from the IMT fund, and Kirk can explain what that is. It's not a general fund. And what we need to do is ask the commissioners in the next budget amendment, which is coming up to you in the next couple of months, just to give the expenditure authority in 2020. But again, it's not an impact on the budget. It's just carrying over the budget that was scheduled in 2018 and 2020. But Kurt can give you additional information if need be.
Good morning, Commissioners. Again, Kurt Harden, Director of Emergency Services. So the Homeland Security Region 3 Incident Management Team, it's a Type 3, Level 3 IMT. Thurston County is the lead administrative agency for Homeland Security Region 3. So when the incident management team goes out and works at various fires in response, and I'm going to use an example as Department of Natural Resources in the summer when they do wildland fire response. The team is paid by the Department of Natural Resources, so when that team is paid, they come back in, and that fund is maintained in Fund 1140 by the county, and so it's separate dedicated funding. And so what they've seen is they've done an analysis and determined they need a second trailer to go out for support for wildland fire responses or all hazard responses as well. So what this does is, well, number one, it benefits the Homeland Security Region 3, which is Thurston County is part of, because these resources are available for use during activations by the Homeland Security Region 3 participants. There's 5 counties, and Thurston being one of them. So this has no impact on the Thurston County budget or funds, any Thurston County funds. This was budgeted originally in 2019. The incident management team was unable to pull that together to do the purchase, so that's what it rolled over to 2020. However, it wasn't part of the budget of 2020 because we had anticipated that being purchased in 2019. So that's why it has to be an amendment to give the budget authority to emergency services so that we can then turn out and purchase that and acquire that for the incident management team.
Any questions?
Thank you.
Thank you, Kurt. Number 6, interlocal agreement related to the Chehalis River Flood Warning System.
For your consideration, Commissioners, is for you consider enter into an interlocal agreement with Lewis County to participate in the operations and maintenance of the Chehalis River Flood Warning System. This particular agreement ended on December 31st, 2019, and the initial agreement was started in 2014. In this, based on the participation of Thurston County, the previous agreement included a 14% participation on the efforts of maintaining in the flood warning system. So this agreement is to continue at that level of participation on the next 5 years. So
6,
just
right?
1, 2, 3, 4, 6 years. Thank you. I have to count them. And so just to give you an example, in 2020, the 14% of the $70,081 of the total cost for the county will be $9,811.28. And there's an escalation factor based on inflation. In 2021, the 14% participation from the county will be $11,739.73. This has been covered by the Stormwater Fund in the past, and it will continue to be covered by the Stormwater Fund in the next 6 years. And Commissioner Messer can give you additional information since he participates on.
Yeah, please.
I don't know what else I can tell you. I mean, the Chehalis River flood strategy involves evaluation of a big project and then a lot of little projects. And this is one of the little pieces that has been implemented, I don't know how long ago, several years ago.
Right.
It's been in place for several years to try to mitigate the kind of catastrophic damage they had in '07. So it's part of that system, that broader strategy, and it's been beefed up. We've been adding stations and stuff, but it's Thurston County at 14%, I think is reasonable participation level for what we get out of it for our citizens.
Any comments? I have a couple questions. Three to one. I have not read the agreement, and I don't need to. But if we're agreeing to maintain it, operate and maintain.
We're to participate on the maintenance.
Okay, so if something goes, it gets broken, something happens to it, is that a cost to the county?
No, that we only participate up to the 14%.
Up to the 14%, that's it?
Because the county does not own the facilities.
Great, okay. And my next question was, what if there's some type of a failure? What kind of liability is the county out for?
A failure.
No, if there was a failure of the, to maintain it.
Gauges.
Of the
or
gauges?
Operating it, and all of a sudden something happens,
So
okay, liability to the county.
I would assume if the equipment fails, then the conversation needs to occur at a larger context.
Okay.
And if anything, then at that point, the county also should be in the position to participate at 14%. The 14% is not going to change.
Good, okay.
And there's just one thing is there is a kind of like our Thurston alert, there's a public outreach component. You can sign up for email alerts. And then when the gate, you can say, I want to know when Grand Mountain gets to, whatever level, and then you get an email that triggers when those trigger points are
Right.
are reached.
Good, very good. Then that takes us to the end, and then we have a TBD meeting right after that. Transportation benefit.
Okay,
Commissioner Edwards.
we're on board, let's go. Okay, we're gonna go at 3:30, we'll call to order, approval of the minutes and the agenda. And at 3:35 for the opportunity of the public to address the board. And department items. Let's hear from the county managers, unless you want to turn it over to the Public Works Director.
The Public Works Director.
Good morning, Commissioners. Jennifer Walker, Director of Public Works. The first item on the agenda is to ratify the officers for the Transportation Benefit District. So on January 7th, the Board of County Commissioners nominated Commissioner Gary Edwards as the president, Commissioner Ty Menzer as the vice president, and Commissioner John Hutchings as a board member for the 2020 Thurston County Transportation Benefit District.
Okay, go ahead.
Okay. The second item is a report of our 2019 Transportation Benefit District Annual Report. We met actually 3 times last year, the Transportation Benefit District did. And so we'll go through the annual report and then request for posting of that.
Is that like a legal requirement?
It is,
Yeah.
yes.
Okay, see?
The third item is a presentation on our 2019 transportation projects and programs, so what we accomplished in 2019. We'll present that to the board. And then the fourth, item D, will be an update from the county engineer on the impacts from Initiative 976. And then the final item will be a presentation on upcoming pavement preservation and road maintenance. That'll be presented by staff outlining what we already have approved for 2020, what we'll be doing, and then what we're proposing to do for 2021 and 22.
Okay, and I would, at this point, talk about the need to continue the Transportation Benefit District. So at some point, I'm gonna wanna know how much money have we laid out since the county created the Transportation Benefit District?
Okay.
And what money are we now spending? And then I guess maybe a discussion here with my seatmates about whether or not we need to continue with the Transportation Benefit District. Once we get that, we'll adjourn after that. But we have that as part of our agenda.
Yes, we'll have that. It's actually included in the annual report, but we can have a discussion at the end as well.
Yes, sir.
I have a question on D Delta, the impact from 976, I-976. Are we talking about, would that be just Thurston County? That we're talking about the impacts?
Yeah. Go ahead. Sorry.
So it will be a combination of both on a broader perspective, but then how that's trickling down to Thurston County also, yes.
So has it already trickled to us then? Feedback, or is it
In
pending?
a small way, I would say more just it is putting a couple of things just on hold until the legislature makes the determination as how they're moving forward. We anticipate, I believe, that might be happening next week.
Oh, okay.
And then the courts haven't really weighed in yet on this whole thing either, so we're in limbo.
Correct. I believe there's an appeal that's happening.
Yes, sir.
So last year, this might be part of the annual report, but I know last year, one of the meetings we had, we kind of did an overview of the kind of the budget for roads, the road fund, what we really would like to have for preservation and maintenance versus what we do have, looking over time. I'm curious kind of where that stands a year later, frankly, and it kind of ties into Commissioner Edwards' point, because if I'm not gonna feel comfortable deciding whether or not we need a transportation benefit district to continue if I don't know. Like, does this board have a credible plan for stopping the shifting of levy shift out of the road fund? If we do, then maybe I would be willing to contemplate that. But that kind of all ties together in my mind, where we are with our projected budget for the road improvements that we need. And then, because obviously TBD funding is a piece of the puzzle there.
Correct.
So I don't, whether that's for this meeting or, I don't know if that fits into what you already had for annual report, or if that's a separate item.
We did not have that detail included. We can certainly add it for the April meeting to put that together.
Yes, sir.
Maybe a suggestion for the board to consider having actually a work session. The staff can present all that information, and at that point you have an opportunity to have a dialogue among yourselves.
Are you suggesting after we have this meeting next week?
Right.
Yes, sir, go ahead.
So I was gonna ask if we could add that, unless it's already packed, to our next work session, not work session, but the planning session we have on an all-day Friday.
I think I suggest having a different work session.
Okay, all right. That's good, fine with me.
That's fine with me.
Okay, fine with me, we'll adjourn.
So I have a question then. No, this is
More on this?
No.
Okay.
We have, for the 17th, we've got a very skinny, short agenda for BoCC that'll take 30 minutes tops. And this one that starts at 3:30. Is there a way legally to not combine them, but move them closer together, or no?
No.
Okay, end of discussion, thank you. What we're gonna do is, bureaucratic problems. Yes, right.
Unfortunately, the TBD meetings are codified.
Okay, it's 10:27, I need to be respectful of staff, and so we're gonna take a 10-minute break. Please come back at 10:37. We'll start promptly, we have to get through more stuff and then a break quickly. No talking though, because
You're on.
Welcome back. It is still March 10th, 2020, and we're continuing on with the work session. And next on the agenda is the advisory boards and commissions.
Hey,
And
Megan.
I'm going to speed through this real quickly. I've
La
got
Bonita
this for
needs to
law.
be here.
I've got this for La Bonita.
La Bonita.
I've got this for La Bonita.
sorry.
I've got it. I've got it. I'm out. Thank you. I've got it. We already discussed the Ag Committee with Tom Watson and Pack Mountain Workforce Development. There's one application that came in just yesterday, so we haven't even reviewed that yet. It's in your packet. Historical Commission has one vacancy, and Elaine Taylor's applied, but their next meeting is tomorrow. It'll get that subsequently. Storm and Surface Water Advisory Board, we have 2 applicants for their meeting is on March the 19th. And Veterans Advisory Board, Fran Beer has applied, and their next meeting is April 20th. So we have a ways to go, and that's all there is for advisory boards and commissions. We have a proclamation pending for National Service Recognition Day for the April 7th agenda. We haven't seen this yet, but Sarah McWilliams, United Way of Thurston County, Vista leader, will be here to accept this. So it's in your packet again for review. If there's any questions or comments or additions, deletions, please send them to La Bonita, and that ends that part. Yeah, you'll check in.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. A quick update, Commissioner Hutchings, Thurston County Connection is going to go out this week. And so that should be ready to go for your show. And then
Was that the
it was the Warrior Live.
Okay.
Yeah, and Brian sent it to that group. They really liked it. They're gonna share it too.
Oh, good, good.
And so that's going to be going out this week. I don't know exactly what day, but it will be this week. And then I've been supporting public health on the COVID-19 response, so that's been a lot of my time. Do you have?
That presses everybody into service, doesn't it? It presses everyone into service. Do you have anything for PIO?
Has there been any, like, feedback on the HCP releases? Have you gotten any?
I haven't gotten a lot. I can check with CPED to see if they're getting comments. But through social media and through me, I haven't received any
Okay,
comments on
just
that.
checking.
Okay, nothing from the commissioner.
Oh, nice. Good news. What? Sorry.
So thank you, that's it. This is all working fine, and no miscues or anything?
There's a couple adjustments we're making. That monitor during the Board of County Commissioners didn't show the people's faces that were at the podium. We're working on getting a fix for that. It won't be fixed for today, but it will be fixed soon.
Okay,
So that's one thing that we're working on, and the contractor comes in and they've been continuing to adjust to make sure that it's, the sound is what we're looking for, so.
fine tuning.
Yes.
Thank you. All right, thank you, PIO. Thank you, Megan. Legislative update, we have one this morning with Keita Marino, all housing related, and county manager.
Yeah, I'm going to go through the weekly report. I'm not going to go through each one of those, but I'm just going to highlight some of the bills they have already passed and is heading to the governors for signature. So I may probably touch on some of those bills that Keely already mentioned this to you this morning. House Bill 2311, this is the amended the state greenhouse gas emission limits. That is going to the governor's office, past both houses. The next one down on the first page is House Bill 2567 concerning the open courts. That's also going to the governor's for signature. Moving to the next page.
Open courts, does that mean the ISIS? The
Yeah,
ISIS?
that's the ICE. House Bill 1590, allowing the local sales tax for affordable housing imposed by a councilmatic authority. That's what Keely was mentioning this morning. It's going to the governors for signature. The next one down, I'd like to highlight the House Bill 2427. That's something the commissioners were interested in, and that's the tackling climate change as a goal of the Growth Management Act. That's dead. Didn't happen much on that.
I'm sorry, which bill was that one?
The substitute House Bill 2427.
24.
Page 2, almost to the bottom.
Oh, got it, thank you. It's dead.
Yeah. The substitute House Bill 2411, preventing suicide, that's moving to the governor's office for signature. House Bill 2614 concerning the paid family leave, and that was just changing some of the past law. It's getting to the governors as well. The next is the Senate Bill 6309, and that's the expanding access to nutritious food. It's getting to the governors for signature. Moving on to page 3, House Bill 2673. That's concerning exemptions in the infill development under the State Environmental Policy Act. That's also moving to the governors for signature. Moving down to halfway through the page, Senate Bill 6229. That's the streamlining reporting for recipients of housing-related state funding by removing the Washington State Quality of Work Program requirements. And that is a big step, big help for us. It eliminates a lot of administrative requirements that we need to meet, and that is going to the governors as well for signature. And last but not least, at the bottom of page 3, that's the Senate Bill 5522, and that is related to the annexations and unincorporated areas of the county within the GMA, and that is moving to the governors for signature. Yesterday, the governor made an announcement that perhaps is going to limit the public signing of the many different bills. So we'll see how that happens. Hopefully, we'll have an opportunity to participate in the signature of some of the bills outlining my report today. That's all I have.
Any questions? Any questions? No, okay. Thank you. No public hearing decisions pending?
No.
All right, that takes us to commissioner items. The first one is dangerous dog designation.
Yeah, you had a brief conversation last Thursday related to a complaint that you received back in February 24, 2019 from Mr. William Purdie. And he is representing the interest of Ms. Krista Roberts, who is the mother of a special needs child whose dog was attacked by a neighbor dog. And you heard some of the testimony. In this case, you have a copy of the full packet that I was submitted to you, which includes very graphic pictures of the attack for your consideration. And also, there was 2 things that you want me to do is have Elizabeth be in here to walk you through the process, what that is. I understand the process from my point of view is pretty straightforward, but she will check me in and answer any questions you may have. But also, for your consideration, there's a draft letter in here where we have drafted for your consideration to declare this dog as a potential dangerous dog. This is what we have in this letter for your consideration. And again, I'm not expecting you to read this letter, but that's the gist of this letter. And it's very prescriptive. But before we get to that point, maybe I can walk you through how you understand the process is, and then maybe Elizabeth can fill in the gaps, perhaps, as I understand the process. So the county has the option under Thurston County Code 9.10070, where can, upon the receiving documentation related to a potential dangerous dog as to how you, the Board of County Commissioners, or their designee, that's clear on the code, you can exercise your ability to declare either a potential dangerous dog or a dangerous dog. And they have 2 different ways to do that. Within the process, you can probably determine based on the evidence provided to you, a letter. This is the gist of that letter as to how you can declare, in this case, a potential dangerous dog. This letter is submitted to the owner or the perceived owner of this dog, the dog in question, and then the owner has 10 days to object your designation. Within 10 days, the owner of this dog will submit a formal request for a hearing. And you will have the opportunity to hear at that point both sides of the issue. And in this case, you will have the opportunity to hear as to why you should reconsider the designation of potential dangerous dog by the owner of this dog. And then after that, you will make a final determination after you have the opportunity to hear both sides. And that final determination is appeal to the hearing examiners in the city of Lacey. And that's how it's being codified. And at that point, I believe that is final. And I believe that decision of the hearing examiners also can be appealed to Superior Court, but that's not part of the code. And that's just part of any option any citizen will have in any hearing examiner's determination. So Elizabeth is here to really walk us through a little more in detail. This is just the highlights of how you understand the process.
So based on that,
Will you introduce yourself, please?
yes, Elizabeth Petridge, Deputy Prosecuting Attorney. Within that high-level context, what you have before you is you have a written complaint from the owner of a dog that has been bit by another dog. And before you can move forward with making a declaration, you have to determine from the letter that's been provided to you whether or not that dog has bit the other dog, and whether or not there are other reports on file with Animal Services, and any other information in that letter that might suggest supporting moving in the direction of declaration of potential dangerous dog. So in the letter before you, you have an eyewitness account of this dog being attacked by the neighbor's dog. You have evidence of the severity of the injuries that the dog suffered in terms of photographs and vet bills that they've had to pay. And you do have information about a prior report with Animal Services about the aggressive behavior of the dog. That's the minimum threshold that you need and that you have in this letter before you to move forward with making a declaration of a potentially dangerous dog. As Romero pointed out, this person, and this letter has to be served by certified mail or personally, and then the owner has 10 days to say, hey, wait a minute, this isn't what happened, this isn't true, whatever. Or the owner might not contest it, and then that would be the end, and then the dog would be declared potentially dangerous. And in your declaration of a potentially dangerous dog, you also will put in code-provided, authorized restrictions on that dog, such as that dog must be on leash if they're out with their owner and under physical control of the owner. And if they are in their yard or on their property, they need to be securely either tethered or fenced in. Those are the typical provisions that you would be putting in. If the person decides to object and timely objects, then as Romero said, there will be a hearing before you where you'll be able to hear both sides and then either reaffirm your declaration, modify it, or rescind it. After that point, that's the end of the role. At that point, your role ends in this process, and then it potentially would move to the hearings examiner if the owner decided to appeal. I have reviewed the letter. I do want to make some modifications to it, but generally that's the information that will be in the letter.
Okay, go ahead, sir.
Does the victim get CC'd on the notice?
We'll make sure that is the case.
And then my other question you just answered, whether you drafted this letter or...
I have not drafted it. I believe it was drafted by Romero or his staff. I just received it late yesterday.
Okay.
So she has not reviewed that letter.
Okay.
So I can easily, and my modifications would just to be so that you're following the threshold you need and standards you need to put in the letter. But the information, you have all the evidence provided by the complaint
Yep.
to satisfy the
I'm satisfied
designation.
to move forward, so.
Comments?
In the process, I mean, there's always two sides to every story, and we've heard
Yes.
one of them. And the process that's laid out, that allows the other side to come out if they wish.
Yes.
And are we incurring or getting in the middle of a liability situation involving this dispute between neighbors, doctors? Are we getting exposure in one way or the other by doing anything or not doing anything?
But through your legislative action, you've made this process available to people to file a complaint with you. Once that complaint's been filed, then you have an obligation to either make a declaration or not make a declaration.
And there was mentioned by the county manager that there were two options that we could make a declaration that it's
Yeah,
dangerous or potentially dangerous.
Yes, is
Potentially
escalation.
dangerous.
Potential dangerous and also a dangerous dog. It's like level 1 and level 2.
So,
Yeah.
and we would not want to go to the more serious.
No, because we don't have the, we don't meet the standards to jump to
Right.
a dangerous dog.
Yeah, even the lawyer recognizes that, they're only asking for.
Potential dangerous, that's the request of the complainant.
I have just two questions. The pocket gopher was listed by the Congress as a threatened species or to be protected. At such time, they can actually remove that designation. If we designate a dog as potentially dangerous, if it had training or behavioral modification, do we ever, if the owner of the dog wanted to come back and appeal, hey, he or she's not dangerous anymore, is there a rescinding of that?
I
They can
haven't,
work with the dog and, hey, it's fixed. It's not a danger or potential danger.
I can get back to you on that. I don't have that at the tip of my tongue to answer that question.
Okay, and then my final question is, the penalties for violating the above, or they're gonna be outlined in Senate?
Yes.
Yeah, is it a misdemeanor or is it a civil? It's all civil?
Civil penalties.
It's all civil? Okay. All right, thank you.
I appreciate that focus on rehabilitation, not just punishment.
Well, yeah, heck yeah. Go ahead, sir.
I just wonder if we're on the same sheet of paper, because I don't have anything on the backside of mine.
Well, that's probably by design.
Okay.
You don't have that, that's not on it at all?
You got that, you got
Okay.
that,
You got the front?
Apologize.
Back.
take mine.
Is that an extra?
Yeah.
Okay,
I apologize.
So
thank you. I
It-
just
it-
thought maybe you were trying to keep me in the dark there. I didn't know.
Me never.
Yes, Elizabeth?
No, I'm fine.
Go ahead.
did you have a question about what the violations are?
No, just what the penalties were.
Penalties are if the owner doesn't comply with the restrictions that are placed on the dog? Was that your question?
Yeah.
Okay, so that is provided in the code as well. It's not listed in your letter, but an attachment would be included which would list it. So the first one is that the dog may be seized and impounded at owner's expense. And if the person fails to keep the dog confined, they could be deemed guilty of a misdemeanor and subject
so that
to
Okay.
penalties, but that would be a separate action that would be undertaken by the prosecutor's office if facts warranted that type of criminal prosecution. And then, so there could be a misdemeanor or gross misdemeanor. The Board of County Commissioners also could weigh in and could petition the county district court to determine the disposition. That's if it's a dangerous dog. So we're not at that level. So basically, the dog could be seized and impounded at owner's expense, and/or there could be criminal prosecution for misdemeanor.
All right, thank you. Anything else?
No, sir.
Anything else?
Oh,
There may be other counties where the commissioners have more time on their hands. In the sense of, like, for the board to weigh in with the district court on it,
Yeah.
seems a little bit.
That's related to dangerous
Well,
stuff.
still,
Yeah.
it's pretty amazing about that.
Did you have something else, Romero?
Yeah, at least from my point of view, in my recollection, this is a brand new process for all of us to go through. So I personally look forward to how this process evolves and as we move along. And also, you may recall last week that you want to keep that authority within yourself just to see how the process goes. And at some point, if we see depending on the frequency that we receive those complaints, then we may have a conversation whether you'd like to delegate that authority or not.
And I would imagine that Ms. Roberts and Mr. Pardee know that we were discussing this today. Yeah. Okay.
We said we were last.
We mentioned that we're going to bring this back to today. So, but I personally didn't reach out to them.
Very good, thank you. As long as our memories last, or have lasted, is this precedent setting for Thurston County? The BoCC's not done this before, a designation of potentially dangerous?
To my knowledge.
It seems like we may have done it. I just can't recall the particular case.
All right, so it's unusual. Great, thank you very much, Elizabeth.
So,
He said perhaps a long time ago.
Oh. Okay.
are you wanting to move forward with this, or are you wanting more time to think about it?
No, I want to move on.
Okay, so thank you. We'll
Just tweak the letter as you see fit.
Yeah.
We'll drop the letter, finalize it, and then we'll circulate for signatures. But if you have any comments while she reviews that, please let me know.
All right, thank you. Thank you, Elizabeth.
Yep.
Capital Land Trust acquisition. And we're rapidly getting through this agenda because we need to be wrapped up in about 20 minutes.
Yeah. Commissioners, we received a letter back in February 27, 2020, and this is from Capital Land Trust, where they, according to RCW 798.1.5.110, it is required for the Capital Land Trust to inform the legislative body of the intent to apply for a grant for the purchase of preservation land. So, and this is just, I think you've seen in the past similar letters. I don't recall if Commissioner Messer have seen those letters, but the board certainly has in the past. What I consider to be this very procedural. Here in the back is a copy of the location where the Capital Land Trust is planning to purchase this land. This land is close to 94 acres, 94.1 acres, and is located within the Henderson watershed. The staff is here just in case you have any questions. And again, I'm bringing this to your attention just to make sure that we formalize your consideration of this. And at this point, my recommendation will be of no action.
You're gonna just have to advise everybody. Okay.
Would you like to add anything else on that?
Apparently not.
Andrew DeFobis, Community Planning. Yeah, so this is a fairly procedural thing, as Ramiro has indicated. They're required to notify the county, they're required to confer with the county, and in the past, that's happened in this sort of setting where, you know, the board considered it and said, we don't have any issue or objection with this, and that's the message that was sent back to the land trust. On this specific property or project, I just wanted to let you know that they've also applied for conservation futures funds for this project. And so it's pretty typical that land trusts that are seeking WWRP funds will also apply for futures funds as a source of match for that other source of funds. So you will have an opportunity to weigh in on this project and look at it later this year in the context of conservation futures, because it'll come forward with all the other projects that have come in for consideration. So.
Anything?
Public access, how's that fit? And what would that consist of on this property for the public? I mean, we're talking about spending a couple $1 million public's money potentially, so what does the public get out of it other than the set aside of some pristine land? Do we get some kind of public access to go take a walk? What-
On this specific property, I'm not sure. I could certainly look into that. It's varied in the past with conservation futures projects. Sometimes conservation futures has been used to specifically acquire recreational land, or it's been used to set aside habitat by a land trust and include some public access component. It really just depends on the specific property in question and what the vision is for it. But there's a whole range of properties out there that have been funded by futures that either have a lot of public access or none. It's not a requirement of that program. But it is potentially one element of a conservation futures project.
And also, the RCO grant requires a little bit of
It may.
component.
It won't be fenced off.
I'd have to bring that back or look into that more as to what public access would be on this project. But as I said, there will definitely be opportunity later this year for the board to look at all of that because this is a futures project.
Sure. Commissioner? Oh, okay.
So related to this, really is not, I want to hear from the board, no opposition,
No
just,
opposition
okay.
for me.
I would like to know more about public access.
Yeah, we'll bring that
I can
up.
follow up on that,
So
absolutely.
The answer to that question is spending this direction.
Pardon?
The direction the board is giving me is pending answering your questions.
No,
No, I don't think so.
Okay.
We're not there yet.
Okay,
I don't think.
we'll follow up.
Question, but it's gonna move, or I gotta
Yeah.
pose it, I would think.
So if you're okay, I will probably draft a letter to this group, and I will sign on your behalf.
Thank you. Sure.
Thank you.
Thank you very much, Jennifer and Andy.
Thank you.
Moving on to WASAC's request, a resolution for funding for the toxicology lab state.
Yeah. So I'm going to start with the letter that is attached on your packet on the back side. And this is a letter from Mr. Mark Nichols. He's the chairman of the Forensic Investigations Council. And that letter is addressed to Mr. Timothy Davidson. He is the president of the Washington Associations of Coroners and Medical Examiners. The gist of this letter is he is stating the state resources are very limited in terms of processing toxicology samples in their lab, but also as a result of that, a lack of availability at the state lab, some of the coroners across the state have utilized private labs to conduct those tests. So the gist of this letter, it states that perhaps when those tests are conducted in the private lab, is requesting to send that information back to the state so they can gather all that data. That is pretty much in gist of this letter. So as a result of that, as I understand, Clallam County, the coroner's office has engaged the Washington State Association of Counties, and through them has sent a proposed resolution for the county's legislative authority to encourage the legislature to fully fund the toxicology lab, which is managed by the State Patrol. So that's really the gist of this resolution. I did have a conversation with Gary Warnock related to this. He was tracking on this letter dated November 22nd, 2018 to the president of his organization. And he's fully supportive of you considering this resolution.
Have you checked with the prosecutor at Thunheim?
No, I have not.
Okay. So when I received this, WASAC's not taking a stand on it. They're just being the conduit to get it out to all the counties to see if they want to sign on as a letter of support or not. And so that's why it's before us now. Just because of the backup of sexual assault kits and such, the state crime lab is they're inundated, their capacity has reached max to get everything out as quickly and time as they can for trials and prosecutions and such. So I realize this is the first time you've seen it and have probably not a chance to read it. And it is just a a request for full funding and staffing.
And that's gonna go in front of the legislature for next year, so
And
too late this year.
It's too late. And if you see the proposed language on your action, it is, here resolves the Washington State Legislature fully fund, enhance the operations and expand the capacity of Washington State Patrol and toxicology laboratories. And if you ask me, it's a very soft approach. It's just making a statement of that in fact you are considering.
it's an issue
Okay.
that we're all paying attention to.
So does anybody know if I-976, a big portion of that pool of money went to the state patrol? Does anybody know if that affects the crime lab funding?
I'm
That's
not
the funding that they would have to get?
right. I'm not sure. Probably, I would tend to believe because the most affected organization in the state by 976 has been the State Patrol. And I think we have to wait until what the legislature is going to do on their budget to supplement the gaps of that. But somebody can probably assume that perhaps 976 could have an
State would
effect on
to
this.
cut back. State Patrol would have to cut back somewhere.
It just complicates it from my perspective, because I don't know, like now this pool of resources is down, it's cut by 70%. So there's all sorts of programs that are not being funded and weighing I totally understand that the crime lab is underfunded. I've seen it in my own legal practice, so I agree with that, but then when you're competing against all these other, now a whole bunch of things are underfunded because of I-976, and is this the right thing to funnel the resources to? I'd have to know quite a bit more about what the competing interests are for that limited pool of money. Also, like to say fully fund, what does that mean exactly?
Well, and it's
Just
like
whatever they want? I mean, there's no meaning to that phrase from my perspective.
it is, and that's what my response to that is a very soft language, really, because it's not on a specific $1 million, $2 million, whatever the dollar amount is. But it's similar to some of the previous efforts that you see fully fund, foundational public health, right?
That's $500 million.
Yeah,
Fully fund education, look what that meant.
Yeah.
Fully fund
So, and
public defense.
But they might, the toxicology lab may have, I don't know if they do or not, they may have that down in writing, hey, we need 2 more bodies, we need 10 more bodies, we need all these supplies. And I don't know if it goes into, we need a greater capacity of the facility to add more employees. I don't know where it starts and stops. I'm sure they have something in mind where they would use that money regardless of supplies and staff.
but also from the county's point of view, and this is Gary's perspective, is when he is in need of processing a toxicology lab analysis, because the backlog at the state lab is so long, then he needs to go with a private lab, which is a cost. So it is a cost, additional cost to the county.
I might support enhance operations and expand capacity. I don't know if I'm okay with fully fund, because that just adds a whole bunch of complexing, competing fund interests that I don't have enough scope to understand.
Yeah, absolutely. That's exactly the conversation that you need to have. First of all, whether you're interested on exercising your authority to pass this resolution, and if so, then what type of language you feel comfortable on the action.
Do you have any thoughts, Commissioner?
Well, I'm just wondering, my main concern on all this is whether or not we're adequately funding those law enforcement rape kits. Because 2 years ago, I thought the legislature gave adequate funding, and you mentioned that that's maybe part of this. I'm just wondering, are they not testing those now?
No, this is toxicology. And I think the one
It's not the same lab.
Well, the same lab. I think what you're referring to 2 years ago, the legislature did fund, I don't know, fully fund, but did fund the backlog of rape kits. And it's a little bit different. Maybe the same lab, but it's a different aspect of it.
Did they ever get that accomplished? Did they ever They did all those.
Well, I don't know if they cut the backlog.
Did they take care of it?
I couldn't tell you, I haven't researched that.
I've said this publicly, so I'll say it here. I've never understood why they never did fund those analysis of those rape kits, and I don't know if they're trying to protect a potential suspect that is gonna be exposed at some point. I don't know. They're doing DNA, and boy, that's gonna be a large reach. And maybe somebody up there at the legislature is a suspect and doesn't want to be exposed. I don't know.
The fifth,
I wouldn't go that far, but
on the fifth whereas, the Washington State Legislature has over the last several years adopted legislation and made appropriations to address a significant backlog of sexual assault kits across Washington. And the next one, whereas similar progress has not yet been made by the Washington State Legislature in relation to other forensic testing backlogs that have come to exist within the crime lab for toxicology. And so I don't know if the sexual assault kits, if that's fully funded or adequately funded, I don't know.
Kind of implies it.
But to hear also that it's impacting the county financially because of the backlog at the state level, we are outsourcing it to a private company.
that's my understanding from Gary, yeah.
Okay, Gary Warnock.
From the coroner, I'm
And
sorry.
I'm supportive of this, and whether we say adequately or fully fund or just leave it, enhance the operations of, for the capital county, and I want us on the record saying, yes, legislature, please give them the adequate resources to get stuff done, because in the balance, this is regarding either victims and or suspects, and they shouldn't have to wait. That's my opinion.
So what I'm hearing, the board is supportive of considering this? And so, based on your comments, I will draft change the language on the.
Wants to change it, I'm fine with that.
Just take out the fully funded, or fully funded.
That would be fine with me if we just said that we want to enhance operations and expand capacity of this toxicology lab, because it was ridiculous. I mean, if you had a drug DUI or I had drug DUIs that like went 18 months without getting the test result. I mean, it's kind of absurd.
Expanding operations and capacity is pretty much funding it.
Yeah.
Justice delayed is justice denied.
Yeah.
Yes. Yeah.
Sometimes.
Okay, so on an upcoming meeting, I will bring this for your
All right,
consideration.
thank you, sir. Thank you, gentlemen. Takes us to public testimony. It's 11:15, we're looking good.
Looking good. I don't have any public testimony that I need to follow up.
So we want to start the executive session to give us sufficient time, but right before that is commissioner items. Do you have a burning issue, boss?
No, I think we better do the executive session, sounds like.
Do you have anything burning, boss?
COVID-19 covered what was my burning issue, so.
Perfect, okay. Well, then we're going to go into executive session. Thank you, ladies and gentlemen, for watching, and we'll see you next time. This afternoon, 2 o'clock.